Thank you for joining us in our health lesson where we are discussing high blood pressure causing foods. Some foods increase the risk of contracting hypertension, while others help in preventing, controlling, and managing our blood pressure. Hypertension causing foods increase the risk of obesity, high bad cholesterol levels in the blood, increased plaques in the blood vessels, which narrows the arteries, leading to hypertension. At the end of this video, we will also discuss a summary on lifestyle changes that can help in reducing the risk of high blood pressure apart from food. Please continue supporting this channel by watching, subscribing, sharing, and liking. The high blood pressure causing foods include: number 1, processed and fast foods. Most processed foods and fast foods contain high amounts of salt or sodium, which causes the body to retain excess fluid or water, which increases the blood volume. This requires the heart to use more force to pump the increased blood volume, and this can lead to increased blood pressure and hence causing high blood pressure. Number 2, saturated fats. According to research by American Heart Association, saturated fats increase the amount of bad cholesterol or low density lipoprotein, that is LDL. High levels of low density lipoprotein cause a buildup of fatty deposits, which we call plaques in the arteries, which narrow the arteries. The narrowing of the arteries or the blood vessels reduces or narrows the lumen through which the blood flows. This makes the heart to use more force so that it can pump enough blood to the body organs, and therefore increasing our blood pressure, which can lead to high blood pressure. Foods with high saturated fats should be reduced in our diet, and these foods include cheese, butter, fried foods, chicken with skin, fatty red meats, among others. Number 3, table salt. Our kidneys help in pulling unwanted fluids and toxins from the body cells and send them to the bladder. Increased salt makes it harder for the kidneys to remove fluids, which then build up in the body, increasing the blood volume. Increased blood volume requires the heart to use more force to pump the blood to other body organs, and this can lead to increased blood pressure, which finally increases the risk of high blood pressure. For prevention, control, and management of high blood pressure, we should reduce or take adequate amounts of salt. Number 4, sugar and sugary foods. Increased intake of sugar increases insulin levels, which activate the sympathetic nervous system, causing an increased heart rate and therefore increasing our blood pressure, which can lead to increased chances of contracting high blood pressure. Sugar in large amounts reduces the sensitivity of the receptors that regulate the body's blood pressure, which can lead to constriction of blood vessels, which then lead to high blood pressure. Sugary foods are quickly and easily digested. This makes some people to have increased appetite, whereby the body increases the production of appetite increasing hormones, that is the ghrelin hormone. This makes people to eat high amounts of food, which can lead to obesity, which is a risk factor to hypertension, and therefore we should reduce the quantity of sugar or sugary foods taken regularly. Number 5, red meat. Metabolizing red meat in our bodies releases compounds that elevate our blood pressure. Red meat and other processed meats have high amounts of fat, which may lead to increased low-density lipoprotein (LDL) or the bad cholesterol in the blood, which can lead to hypertension or high blood pressure. Number 6, alcohol. Alcohol has more empty calories, which may induce us to eat more quantities of food. This can lead to overweight or obesity, which lead to hypertension. Therefore, unregulated intake of alcohol can lead to high blood pressure and more other non-communicable diseases. Number 7, prepacked processed foods. These foods have high amounts of sodium, which increases the blood volume in the body and therefore giving the heart harder time in pumping our blood to other body organs. The straining of the heart increases our blood pressure and this can lead to high blood pressure. The following is a summary on the lifestyle changes that can assist in prevention, control, and management of high blood pressure. Number 1, eating foods with low amount of fat, salt, and sugar. Number 2, doing regular physical activities, which may include walking, jogging, swimming, cycling, among others. This improves the health of the heart, the blood vessels, and other body organs, ensuring improved circulation of blood and normalized blood pressure. Number 3, managing a healthy body weight, which can be done by eating health, that is, eating balanced diet with high amounts of vegetables and fruits, taking enough water, having enough sleep, managing our stress, among other lifestyle changes. Number 4, quitting smoking. Smoking can lead to poor circulation of blood in the body. Therefore, we should quit smoking so that we are able to improve the health of the heart, the health of the blood vessels, and other body organs, including the liver. We have more videos on how to prevent, control, and manage high blood pressure in our channel. Please continue watching, subscribing, liking, and commenting. And for those who have questions, please you can ask in our channel.